Can traumatic brain injury cause neurodegeneration over time? Can traumatic brain injury really lead to neurodegeneration as time goes on? The answer is yes. Traumatic brain injury, often called TBI, can indeed contribute to progressive brain damage. This can increase the risk of developing conditions like dementia and memory loss later in life. Current scientific research supports this connection and highlights the importance of understanding the long-term effects of TBI. To break it down, TBI happens when an external force causes physical damage to brain tissue. This can disrupt the brain's neural networks and its overall function. After the initial injury, a series of biological processes can begin that lead to chronic neurodegeneration. For instance, structural damage from TBI can result in ongoing loss of neurons. One specific process involved is called Wallerian degeneration, where nerve fibers deteriorate away from the injury site. Studies have shown that people with a history of TBI have a higher long-term risk of developing dementia. This includes Alzheimer's disease and other forms of cognitive decline. Research has adjusted for various factors, such as sex and socioeconomic status, confirming that TBI is a significant risk factor for dementia. The persistent effects of brain injury can impact critical areas involved in memory and cognitive function, like the neocortex and hippocampus. An important mechanism at play is the impairment of the brain's glymphatic system. This system is responsible for clearing out metabolic waste and toxic proteins. Research on animals indicates that moderate to severe TBI can disrupt this function over the long term. This disruption can lead to the buildup of harmful substances, such as amyloid beta and tau proteins, which are linked to Alzheimer's disease. Clinically, the neurodegeneration related to TBI can show up as progressive cognitive deficits, memory loss, and even behavioral changes. These symptoms may not appear until months or even years after the injury, which emphasizes the need for long-term monitoring and care for those who have experienced TBI. There are ongoing efforts to tackle these challenges. Emerging regenerative medicine approaches aim to repair damaged brain tissue and restore function. For instance, some new federal programs are exploring the use of adult-derived stem cells to regenerate neocortical tissue affected by trauma, stroke, and neurodegenerative diseases. These advancements hold promise for reducing the long-term consequences of TBI and potentially alleviating the burden of dementia and memory loss. In summary, traumatic brain injury can indeed lead to neurodegeneration over time. This can increase the risk of dementia and memory impairment due to a mix of direct structural damage, impaired waste clearance, and ongoing pathological processes triggered by the initial injury. Understanding these mechanisms is vital for developing effective treatments and supporting brain health in individuals who have suffered a TBI. Always consult healthcare professionals for personalized advice and guidance regarding brain health and recovery.